All right, so part 2 of chapter 8, and we ended part 1 on this figure and just ran out of time to mention or explain a little bit more about category C, where a patient will actually be classified as having AIDS. So in category A and B, a person is HIV positive. Category C, they have AIDS, and AIDS is going to be defined as having too few of CD4 positive T cells, these helper cells. They have to drop around or underneath the 200 or 250 250 parts per millimeter cubed, right? Just the actual number that they can detect in the blood. And then you also see at that point, the virus doesn't have anywhere to go. And so you have more virus in the bloodstream. And at the point of getting AIDS, then these individuals begin to come down with different types of rare cancers or different types of infections. It could be a really bad type of pneumonia. It could be a yeast infection that is throughout their entire body. It can be different types of meningitis. Kaposi sarcoma is one of the types of cancers that is common in AIDS. And if you've seen the movie Philadelphia with Tom Hanks, Kaposi sarcoma is the cancer that the individual that he was playing in the movie had, where he had those different marks or sores on his body. That was the cancer. So at this point, the patient will become ill, and it really just depends on the exact nature of their overall health, how careful they are at avoiding infections, if there's any way to protect someone as to how long that individual has left to live. All right, so transmission and prevention of HIV. Transmission is through sexual contact or blood contact, and so that is through sexual contact. It can be dirty needles. It can be a blood transfusion, and early on in the epidemic, in the early to mid to late 80s, a lot of individuals came down with HIV because they didn't know how to screen blood for that virus, and so anybody needing a blood transfusion were just simply at risk of getting a bad sample of blood, or even plasma maybe. And then it can also be transmitted from the mom to the baby during pregnancy, but it's actually more common to be transmitted through a vaginal birth. So if the mom is HIV positive, the chances of that infant getting the virus just through the placenta is about 1 in 4. And then the infant is generally going to be born through a C-section, because that limits the amount of trauma on the infant and limits the amount of blood mixing, so to speak. If the infant is born through a vaginal birth, the numbers jump to 3 in 4 infants will be HIV positive after that vaginal delivery. All right, globally, heterosexual sex is the most common mode of transmission. All right, looking at everywhere on the earth. In the United States, it may actually be a higher risk in the homosexual population, but globally it is heterosexual. HIV is not passed through casual contact, and prevention is going to be through abstinence, sex with only one partner who isn't infected, and you can increase your chances of avoiding it with the use of a condom. So HIV testing and treatment. The HIV looks for antibodies to the virus, right? Not necessarily the virus itself. And people will develop these antibodies within 2 to 8 weeks of infection. This is typical, but it can actually take longer, depending on how much virus you are actually infected with. And so if there's a chance that you could have been infected, if you had some random needle prick, if you had sexual contact with somebody, you have to get tested at that 6-month mark, so that you can verify that you only got a little bit of the virus and it's taking your body longer to actually develop those antibodies at measurable levels. Treatment has come a long way in the last 2 decades, really. It was kind of slow to come into, it was slow for the medical community to figure out good treatment options, because that virus really was brand new in the 1980s. But it's come a long way, and that's why we don't see nearly as many deaths that are occurring, because people are living longer with the disease. So there is what is called HAART, highly active antiretroviral therapy. It uses a combination of drugs to inhibit the HIV replication, and vaccines still out there. HIV can actually mutate, and so it's hard to actually develop vaccines. But the difficulty for this, all right, no vaccine is ever proven to be 100% effective. And viruses, the HIV virus, are genetically different from each other, whether you're looking at just the virus that can be found in the United States or that virus that is found throughout the world. And it's unclear whether a vaccine, if it were ever developed, would only provide short-term protection or whether it would be long-term. And there's a big concern on how the vaccine would be made, as to whether or not when you gave the vaccine, if that would actually give a person the potential of coming down with the disease. All right, another issue is the way that the virus works. It hides out in human cells. So it's actually hard for the immune system to see it, recognize it as foreign, and to kill it. So once the virus gets into you, regardless of whether or not you've been vaccinated with a good vaccine, if the virus gets into a host cell before the immune system can kill it, then it's not going to work. And the issue with AIDS or HIV vaccine development is there actually isn't a good animal model, right? Because the virus is very different between us and, say, the virus that is found in chimps, and so we just simply we don't have any other models to use. All right, TB. I believe I took this off of your list of objectives, but it's just a good disease to know about, because it is causing a problem, more so these days than it has in the last few decades. TB is caused by an organism called Mycobacterium tuberculosis, and it is spread from infected persons when they cough, or I'm not sure what that's supposed to be. It's not singing. Sneezing for sure. And if you are around a person who is infected, obviously your chances of coming down with the infection is greater versus if you just randomly saw someone on the street who may have sneezed or coughed in your direction. But the problem with this infection is that the organism has a very, very short or a very long replication cycle. So, for example, if you were to come down with a bladder infection, UTI, you can wake up in the morning and feel just fine, and then by the afternoon, feel sick, feel like you've been hit by a bus. And that's because the organisms that cause UTI infections generally, the best example is E. coli. E. coli causes about 85% of urinary tract infections. That organism replicates every 20 minutes. So if you had one cell, it would replicate in 20 minutes to become 2, and then in 20 minutes, it would be 4 cells, and then 8 cells, and so on. And you typically aren't just infected with 1 cell. And so you can see how someone who might feel fine now could actually feel sick several hours later, because the bacteria has just replicated that fast into high numbers. TB, on the other hand, or Mycobacterium tuberculosis, has a replication time of 18 to 36 hours. And so if you were to come into contact with 100 organisms or 1,000 organisms, 1,000 bacteria cells, which could be pretty decent with a good sneeze and a direct hit to your sinus cavity, all right, then it would actually take you a long time to actually feel sick. And so the incubation period here is listed from 4 to 12 weeks because it actually takes that long for the organisms to replicate to high enough numbers to cause a disruption in your lung activity. All right, so you can have latent TB, patients who have the organism, but it's not active, and so they're not contagious, or patients with active TB. They feel sick, and they're going to be contagious. Another issue with tuberculosis, because it has such a long replication time, the patient actually has to be on antibiotics for a very long time. 6 to 9 months is the time frame that you will have to take antibiotics, and it's generally a combination of drugs because the organism is typically drug resistant, and so you have to take several different drugs that work well together and can fight the bacteria properly. All right, malaria is also another important disease to think about because this is caused by a protozoan. All right, it's not a bacteria, it's not a virus, it's not a fungal drug or a fungus, but a eukaryotic organism, and it is transmitted by mosquitoes, a particular strain of mosquitoes that get inside the mosquito bites you, it injects saliva and material into your skin to keep the blood right there at the source where they're taking their blood meal from coagulating so that they can draw more blood in. And in that process, they are injecting you with the Plasmodium organism. The incubation period is 7 to 30 days. Symptoms can range from very mild to being fatal. Right? There's 4 species of Plasmodium. Some are very mild. One is very bad, which will lead to those fatal conditions. All right, so prevention, you have anti-malarial drugs, and also by simply eliminating the mosquitoes, right, by getting rid of standing water. If you go to an area that is endemic with malaria, then you use bed nets so that the mosquitoes don't bite you in the middle of the night. Use bug repellent, all that good stuff. But it's a major issue, specifically in on the continent of Africa. Right? It's just awful there. And unfortunately, these individuals don't have access to good medical care, the medication for it. They don't have access to bed nets, and so it's just endemic there. And a child, I think it's children, not just any aged individual, but for sure someone dies every 30 seconds worldwide because of malaria, and many of those are going to be children. All right, I think this is where we're going to stop for part 2. In part 3, we'll pick up on influenza and then just move into antibiotic resistance. And so hopefully it'll be a little shorter.